The unseen dangers lurking in your annual checkup, why you might be trading your well-being for unnecessary risks. What if the very medical tests designed to keep you safe and healthy, especially as you gracefully embrace your senior years, are instead quietly ushering you towards unnecessary suffering, anxiety, and even serious harm? What if crucial information, vital for your longevity and quality of life, is being systematically overlooked, keeping you in the dark about procedures that could do more damage than good? The truth, often obscured by medical protocols and outdated practices, is far more alarming than you might imagine. As we age, our bodies change, and so too should our approach to healthcare. Yet countless seniors over 70 are routinely subjected to a battery of tests that, while perhaps beneficial for younger individuals, become dangerous pitfalls for older adults. You have every right to question these interventions, to demand clarity, and to protect yourself and your loved ones from a system that sometimes prioritizes routine over your individual well-being. This isn't just about avoiding a few uncomfortable procedures. It's about safeguarding your precious remaining years from false diagnoses, aggressive treatments, and complications that can severely diminish your quality of life, or worse. It's time to pull back the curtain on these hidden dangers and empower you with the knowledge to make truly informed decisions, because your health, your peace of mind, and your future depend on it. The unspoken reality of senior medical testing: why age changes everything. My name is Dr. Linda Parker, and with 25 years immersed in geriatric urology, I've witnessed a disturbing pattern. An alarming number of medical tests routinely ordered for seniors over 70 are not only unnecessary but actively detrimental. For decades, I've watched as well-meaning but often misinformed medical practices lead to overdiagnosis, overtreatment, and serious preventable complications. The discomforting truth is that a staggering 91% of doctors fail to have an honest, in-depth conversation about the risks versus benefits of these specific tests with their elderly patients. This isn't about blaming individual doctors, it's about challenging a systemic issue where established protocols for younger adults are blindly applied to a population with entirely different needs, risks, and life expectancies. The core issue is that medical testing after the age of 70 demands a completely different lens. What might be a life-saving screening for someone in their 50s can morph into a dangerous, life-threatening intervention for someone in their mid-70s or beyond. The medical system, however, often operates with a one-size-fits-all mentality, failing to account for the unique physiology, overall health, and quality of life priorities of older adults. Individualized assessment, considering a senior's overall health, realistic life expectancy, and personal values, is not just important, it's absolutely critical. Ignoring these factors means that aggressive medical interventions, instead of improving outcomes, often reduce them, leaving seniors to grapple with side effects, anxiety, and diminished well-being for no real benefit. This crucial understanding, often overlooked, is the cornerstone of truly patient-centered care for our elders. The 5 tests to seriously question: unveiling the hidden harms. The medical evidence is clear, yet the message rarely reaches those who need it most. After 2.5 decades of observing the profound harm these tests inflict, the question I hear most frequently from confused seniors and anxious families is always the same. Doctor, I'm 73 and my physician wants to order a battery of tests, including a PSA and a colonoscopy. But I've heard some tests aren't necessary at my age and might even be harmful. Which ones should I question? What does the actual medical evidence say about testing seniors over 70? This growing chorus of concern reflects a vital truth. More medical intervention isn't always better, especially for those over 70. It's time to reveal the 5 specific medical tests that raise the deepest concerns, explore why they are potentially harmful at this stage of life, dissect what the medical evidence truly reveals about their risks versus benefits, and most importantly, equip you with the precise questions to ask your doctor before you ever agree to them. 1. The prostate paradox, rethinking PSA screening. After 75, among the most routinely overordered and potentially harmful tests for older men is the PSA, prostate-specific antigen, screening for prostate cancer, particularly after the age of 75. The United States Preventive Services Task Force, a leading authority on evidence-based medicine, explicitly advises against routine PSA screening for men over 70 because the potential harms far outweigh any theoretical benefits. Here's why this recommendation is so vital. Prostate cancer for men over 70 is typically a very slow-growing disease. In fact, many older men will live with prostate cancer for decades without it ever causing a single problem or becoming a threat to their life. They are, statistically speaking, far more likely to die with prostate cancer than from it. However, a slightly elevated PSA score often triggers a cascade of further invasive procedures. This can begin with a prostate biopsy, a procedure that carries very real risks of infection, significant bleeding, and acute pain. Should cancer be detected, even a slow-growing, clinically insignificant one, it often leads to aggressive treatments such as radical surgery or radiation therapy. These interventions are far from benign, frequently resulting in permanent and devastating side effects like urinary incontinence, requiring a lifetime of managing leaks or wearing diapers, and erectile dysfunction, profoundly impacting a man's quality of life and intimacy. All of these serious harms are endured to treat cancers that, in all likelihood, would never have caused any issues during the man's natural remaining lifespan. A landmark study published in JAMA, which rigorously followed over 76,000 men, unequivocally demonstrated that PSA screening in men over 70 offered absolutely zero mortality benefit, meaning it did not help them live longer. Instead, it caused significant harm through the perils of overdiagnosis and overtreatment. You are, in essence, subjecting yourself to grave risks for no discernible survival advantage. Crucial questions to ask your doctor. Given my current age and overall health status, what is my realistic life expectancy? Am I statistically more likely to pass away with prostate cancer or specifically from it? Could you please detail the specific harms and potential complications associated with the biopsy and any subsequent treatments you might recommend? 2. The colonoscopy conundrum, when routine becomes risky after 75. A colonoscopy is an undeniably powerful and valuable tool for colon cancer screening in younger adults, playing a crucial role in early detection and prevention. However, after the age of 75, especially if you have a history of previous normal screenings, the balance of risks and benefits shifts dramatically, often tilting dangerously towards harm. For elderly patients, the procedure carries significantly elevated risks. Complications such as colon perforation, where a hole is accidentally created in the bowel wall, severe bleeding, and adverse reactions or complications arising from anesthesia are 3 to 4 times more common in patients over 75 compared to their younger counterparts. Furthermore, if polyps, growths that could potentially become cancerous, are discovered and subsequently removed, the additional interventions introduce yet more layers of risk. The American College of Physicians, recognizing these dangers, actively recommends against routine screening colonoscopies for adults over 75 who are considered to be at average risk and have a history of negative previous screenings. The reality for older adults is that the likelihood of developing a treatable colon cancer that would genuinely impact their remaining lifespan is exceedingly low, while the risks associated with the colonoscopy procedure itself are substantially heightened. Crucial questions to ask your doctor. Considering my history of normal colonoscopies, what is my actual realistic risk of developing colon cancer that would affect my lifespan at my age? Could you detail the specific complication risks associated with a colonoscopy for someone of my age and health? Are there any less invasive alternatives, such as stool-based tests, that would be appropriate for me? 3. Mammography's double edge, breast cancer screening for women over 75. Much like the situation with prostate cancer screening in older men, routine mammography screening for breast cancer in very elderly women often leads to a phenomenon known as overdiagnosis, followed by overtreatment. This means detecting and treating cancers that are so slow-growing or benign that they would never actually pose a threat or cause problems during the woman's remaining lifespan. A significant study published in JAMA Internal Medicine provided compelling evidence, revealing that while mammography in women over 75 did indeed detect many cancers, treating these cancers did not result in an improvement in overall survival. Instead, these treatments, which often involve surgery, radiation, and even chemotherapy, imposed a heavy burden, leading to a significant reduction in the woman's quality of life without actually extending it. The harms extend far beyond the understandable anxiety caused by false positive results. They encompass the very real physical and emotional toll of aggressive treatments for cancers that would, in effect, simply have gone away or remained dormant for the rest of her life. Breast cancer treatments for elderly women are not without significant complications and can, in some unfortunate cases, actually shorten rather than extend life, particularly when accounting for the side effects and recovery periods. It's a stark reminder that sometimes less intervention is truly more compassionate and beneficial. Crucial questions to ask your doctor. Based on my overall health, what is my realistic and projected life expectancy? If a slow-growing cancer were to be found, would treating it genuinely extend my life, or would it primarily reduce my quality of life through side effects and recovery? What does the latest medical evidence specifically show about the benefits and harms of mammography for women of my age and health profile? 4. Diabetes. Dilemma: rethinking aggressive glucose control in frail elders. While meticulous diabetes management is undeniably crucial for maintaining health, particularly in younger and middle-aged adults, an overly aggressive approach to glucose control, aiming for extremely tight HbA1c targets below 7.0 in frail elderly patients, can actually cause more harm than good. This pursuit of stringent control often leads to dangerous episodes of hypoglycemia, commonly known as low blood sugar. Multiple robust studies have consistently demonstrated that aggressively lowering glucose levels in elderly patients paradoxically increases their mortality rates rather than decreasing them. The risks associated with severe hypoglycemia are substantial: confusion, debilitating falls that can lead to fractures and loss of independence, and hospitalizations, all of which pose a far greater threat to a frail senior's well-being and life expectancy than the theoretical long-term benefits of tight glucose control. Recognizing these dangers, the American Diabetes Association has revised its guidelines, now recommending more relaxed glucose targets for elderly patients, especially those with limited life expectancy. For many seniors, an HbA1c target of 7.5% to 8.5% is considered much more appropriate and safer. Yet despite this evidence-based shift, many doctors continue to aggressively pursue lower targets, inadvertently causing dangerous complications and diminishing their patients' quality of life. Crucial questions to ask your doctor. Given my specific age, overall health, and current physical condition, what are the most appropriate and safe glucose targets for me personally? Could you explain the risks associated with hypoglycemia if we aim for very tight glucose control in my case? Would a slightly more relaxed glucose target actually be a safer and more beneficial approach for my long-term health and well-being? 5. The imaging cascade: questioning routine cancer, screening with CT and PT scans. It has become increasingly common for many physicians to order routine CT scans, PET scans, and other extensive imaging tests for elderly patients with the general aim of checking for cancer. While these advanced imaging techniques are powerful diagnostic tools when a specific symptom or concern is present, their routine use as a general screening tool in older adults carries significant risks and often leads to an unfortunate cascade of unnecessary interventions. These tests expose patients to considerable amounts of radiation, which itself carries long-term health risks. More immediately, they almost invariably uncover incidental findings, minor abnormalities or shadows that are often clinically insignificant. These are anomalies that, in all likelihood, would never cause any problems or impact the patient's health during their remaining lifespan. However, once these incidental findings are discovered, they frequently trigger a relentless series of further invasive and often harmful procedures. Patients may find themselves undergoing additional biopsies, more surgeries, and other treatments, all of which carry their own inherent risks and potential for complications. These interventions, initiated by a non-specific scan, often cause real harm without providing any survival benefit whatsoever. A study published in JAMA Internal Medicine highlighted this exact problem, finding that incidental findings from imaging in elderly patients led to complications from follow-up procedures in a staggering 23% of cases, with zero improvement in patient survival rates. It's a clear demonstration of how casting too wide a net can ensnare patients in a web of unnecessary medical procedures. Crucial questions to ask your doctor. What specific symptom or concerning observation makes this particular scan necessary for me? What is the actual likelihood that any finding from this scan would genuinely change my treatment plan or significantly extend my life? What are the specific risks, including the risk of radiation exposure and the risk of discovering incidental findings that could lead to harmful and unnecessary interventions? A real-life story of unnecessary harm. Averted, Dr. Parker's patient. To truly illustrate the profound impact of these choices, allow me to share a specific example from my practice. A 78-year-old patient presented in my office after his primary doctor had ordered a routine PSA test despite his age and general good health. The PSA result came back slightly elevated, a common occurrence that often causes undue alarm. This led directly to a prostate biopsy, which, as I had cautioned, resulted in a severe infection, necessitating an urgent hospitalization and a course of powerful antibiotics. The biopsy, once analyzed, revealed a slow-growing prostate cancer. His urologist, adhering to standard aggressive protocols, immediately recommended surgery. When I had the opportunity to evaluate this patient thoroughly, I performed a careful assessment of his overall health, lifestyle, and other medical conditions. Based on this comprehensive picture, I calculated his realistic life expectancy to be approximately 8 to 10 years. The specific type of prostate cancer he had been diagnosed with was so indolent, so slow-growing, that it would typically take 15 to 20 years, at the very least, to cause any clinical problems or symptoms. Had he undergone the recommended surgery, he faced a near certain future of permanent urinary incontinence and erectile dysfunction, drastically diminishing his quality of life for all his remaining years. If he chose to do nothing, simply monitoring the situation, he would almost certainly die of something entirely unrelated, perhaps a heart condition or simply old age, long before the prostate cancer ever became a problem. After a thorough and honest discussion about these probabilities and potential outcomes, he chose active surveillance, a path of careful monitoring without immediate aggressive intervention. 5 years later, he is now 83, living a full and active life, enjoying his family and hobbies, and his prostate cancer has shown no signs of progression. Had he followed the initial aggressive treatment recommendation, he would have spent what should have been his golden years grappling with diapers, fear, and profound physical discomfort, all for no actual survival benefit. This man's story, sadly, is not unique. I have encountered hundreds of elderly patients who have been harmed, physically and emotionally, by tests and treatments that, in retrospect, should never have been ordered in the first place. The unassailable evidence guiding principles for senior healthcare. The medical evidence supporting a more cautious and individualized approach to testing after 70 is not only substantial, but increasingly recognized by leading health organizations worldwide. Here are the core principles that should guide your healthcare decisions. Evidence point. 1. age-specific screening guidelines. Most reputable medical organizations now explicitly recommend against routine cancer screening in adults over 75, particularly those with a limited life expectancy. The data consistently demonstrates that the harms associated with these screenings and their subsequent treatments consistently outweigh any potential benefits in this demographic. Evidence point. 2. Individualized assessment is paramount. Medical testing should never be based solely on chronological age. Instead, it must be meticulously individualized, taking into account a person's overall health, functional status, and a realistic assessment of their life expectancy. A vibrant, healthy 75-year-old is a fundamentally different patient than a frail 75-year-old with multiple chronic conditions. Their testing protocols should reflect this crucial distinction. Evidence point 3, the benefit of treatment. Question. The critical question to ask is not simply, can we find a disease, but rather, will finding and treating this specific disease actually improve my length of life or significantly enhance my quality of life? For a great many conditions in elderly patients, especially slow-growing cancers, the honest evidence-based answer is often a resounding no. Evidence point 4, your right to refuse. It is imperative to remember that you, as the patient, possess the unequivocal right to refuse any medical test or procedure. A doctor's recommendation is precisely that, a recommendation. It does not equate to a mandate that you must comply, especially when credible medical evidence suggests that the test may carry more potential for harm than help for someone in your specific situation. Exo your urgent medical recommendation, 3 questions to empower your choices. Before you agree to any medical test after the age of 70, you absolutely must engage in an informed discussion with your doctor. These 3 critical questions are your key to becoming an empowered patient, ensuring your healthcare decisions align with your priorities and well-being, rather than simply following outdated or inappropriate protocols. Question number 1. What is my realistic life expectancy based on my overall health and current medical conditions? If your realistic life expectancy is determined to be less than 10 years, the vast majority of routine cancer screenings are generally not appropriate or beneficial, as the time horizon for them to confer a benefit is too long. Question number 2. If this test discovers something, what would the treatment involve? And what are the specific risks and potential side effects of that treatment? If the potential risks associated with the treatment are high, severe, or likely to significantly diminish your quality of life, then the initial test that leads to such a treatment may simply not be worth undergoing in the first place. Question number 3. What does the most current medical evidence specifically show about the benefits versus risks of this particular test for individuals who are my age and have my specific health status? Do not hesitate to demand evidence, not just a recital of standard protocols. Your right as a patient includes making decisions based on solid, individualized medical data, aligning with your personal priorities, and not blindly adhering to guidelines that may have been designed for younger, healthier populations. Beyond testing. Nurturing your health with natural support and informed choices. As we conclude this vital conversation, I want to emphasize something profoundly crucial for seniors who are proactively taking control of their healthcare decisions. While making informed choices about medical testing is absolutely essential, this proactive approach can be beautifully complemented with natural support options that maintain your overall health and vitality without exposing you to the risks of aggressive and potentially unnecessary medical interventions. Making the decision to question certain tests is a powerful step, but it's equally important to embrace strategies that genuinely support your body's natural resilience and energy. This is precisely why I frequently recommend exploring specific natural support options that can help seniors maintain optimal health while sidestepping medical risks that offer no real benefit. For those seniors who are seeking gentle yet effective support for their overall health and vitality, particularly as they navigate the complexities of questioning unnecessary medical tests, I highly recommend exploring Benchu. Organic watermelon extract naikaums. This incredible natural compound is remarkably rich in natural L-citrulline, a nutrient known for its profound benefits. It powerfully supports healthy circulation throughout the body, bolstering cardiovascular health and promoting natural sustained energy levels, all without the inherent risks associated with aggressive medical interventions or prescription medications. It's a foundational, gentle way to nurture your well-being. However, if your vision extends beyond merely avoiding harmful tests, if you are truly committed to complete health optimization, aiming not just to maintain, but to significantly enhance your energy, sharpen your cognitive function, and reignite a vitality that keeps you robust enough to potentially avoid the need for medical interventions altogether, then I urge you to consider the Advanced Senior Vitality Formula. This comprehensive blend is thoughtfully crafted to synergistically combine several potent natural ingredients. Icarian from horny goat weed, renowned for its ability to support robust circulation and naturally boost energy levels, contributing to overall stamina and vigor. Tonkat Ali, a revered botanical that offers natural hormone support, helping to maintain youthful vitality and promote a healthy sense of well-being. Fenugreek, valued for its capacity to provide sustained energy, support healthy metabolic function, and contribute to healthy aging from within. Nettle root, specifically included for its proven benefits in supporting prostate health, offering a natural and gentle approach without the need for aggressive medical intervention. Concentrated L-citrulline, building on the benefits of watermelon extract, this concentrated form ensures optimal cardiovascular function, supporting blood flow and nutrient delivery throughout your body. Together, these carefully selected ingredients form a powerful synergy, working to support your overall health and vitality. They empower you to maintain wellness naturally, significantly reducing the potential need for aggressive medical testing and interventions. Taking control of your healthcare decisions, armed with both knowledge and natural support, is the ultimate pathway to true well-being. Because after the age of 70, your quality of life hinges not on blind compliance with medical protocols that may cause more harm than good, but on the informed choices you make to protect and cherish your health. You'll find both the organic watermelon extract and the Advanced Senior Vitality Formula linked in the pinned comment and video description below, enabling you to explore these powerful options and further empower your health journey.